Welcome, colleagues and friends, to panel 4, the last panel of our night. This panel will focus on online mental health platforms. I am Dr. Brittany Aleshire. I'm assistant professor of psychology at Brandman University for our MI Psychology program. I'd like to warmly welcome our two panelists. Dr. Michelle Haley, you've already met. She is the innovative and creative founder of TogetherWell. She has over 15 years of experience in the mental health field, and she received her PhD in clinical psychology from California School of Professional Psychology at Alliant University. We also have Dr. Matthew Harris. He's a clinical neuropsychologist who was drawn to participating in TogetherWell because it combines his love of research, helping others, and promoting education. Dr. Harris holds a PhD in clinical psychology from the California School of Professional Psychology at Alliant University. So the first question that I have here is for both of you guys, but first I'd like to hear from Dr. Harris. What are online mental health platforms and what services do they provide?
So that's a good question. We've been talking about online mental health platforms so far without really defining it, and we've been mostly focusing on psychotherapy and counseling. So I want to zoom out for a second, talk about how these mental health platforms, they're really any entity, any online presence that uses technology to provide mental health care. So what's that mean? It means that with new technology, such as secure video conferencing like Zoom, VC, these mental health providers are able to bridge the gap in service needs and provide resources where needed. But just like offline mental health care, there's a wide variety of what this can mean in quality, but also in the nature of what we're doing with to help people. So these mental health platforms, they can include apps, they can various types of websites, of course, but also YouTube and other social media accounts. Some of these are more educational tools, giving informational videos, informational readings. Some of these are more of a contact platform to provide people connections to psychotherapists or support groups. But increasingly, more and more of them, as we've talked about today, are providing one-on-one counseling through chat, audio, or video, or even support groups through audio and video. So we talked about providing therapy online, but I just want to emphasize that online platforms can help in a myriad of ways outside of just a therapy session. And that's hopefully what we're going to get into a little bit with this section.
Cool. Yeah, and I would just add to that. So I live in Oakland, California, the Silicon Bay area. And so I go to quite a few tech events. And so what's really wonderful is there are so many tech entrepreneurs that are trying to do good in this world. And so something to be mindful of when you're seeking out different mental health platforms or apps is to really research who is developing them. So in some of the types of tech events I go to, they're called pitch events. And so people pitch their tech products. And I've gone to several events where people are not mental health founders or co-founders, and they are pitching products that are for like ADHD and other diagnoses, and they have no actual background in that whatsoever. And they're also not consulting with psychologists or other mental health providers. So that's a concern. I've also seen other apps. There's one that is sort of like, kind of is trying to replace an actual therapist. So basically you write into this app, like, this is how my day's going. And then the app responds saying something like, oh, I hope you have a better day, or, you know, some sort of transcript. And so in this particular situation, I spoke with that person. I was like, well, what if someone says they're suicidal? Like, do you have a notice that pops up? Like, what happens? And they said no. And I said, okay, well, who are you consulting with on this? And they said, just myself, like my own self-help. And so this is really important as we're entering this new space, is that we really make sure that the products that we're using, we're really researching them, and not even just researching, connecting with colleagues. There's so much value in our community and reaching out and saying, did you use this? How did you find out about it? So, and an easy way to do this is to go to, for example, an app website or a product website, and you go to the About Us page, And a lot of times the founders are listed there and you can read their bios, and you could even just shoot them a message. Hey, who was your consultant on this product? And actually on LinkedIn, several people have reached out to me and asked me to consult on mental health apps. So to do that, but I've seen certainly several circumstances where they have not done that. And then also just to speak to about like compliance issues too. So there are these platforms that are great for doing like actual clinical work, but then there's also these tools. So kind of separating the platform from the tools. So like a Zoom. And so if you're using a Zoom, I've definitely during this time, I've heard colleagues say, I've been using Zoom and I thought it was HIPAA compliant. I did not know it was just the basic model and that there was a HIPAA compliant version, because they had heard people say it's compliant, not knowing that they needed to upgrade. And that one's actually like $200 a month and you get like 10 hosts on it. With everything going on with Zoom, I don't know if their pricing's changed, but that was like maybe a month and a half, 2 months ago when I looked. But besides that, also considering like other tools, like I've also heard people say that they were doing therapy with FaceTime. So, you just really want to make sure that you're double checking that it's HIPAA compliant, and that you can simply contact customer service to find out too, if that's correct. So that's just what I would add to that. Yeah,
that's really great. I think, I really appreciate the overview of all of the online mental health platforms and kind of the varieties of areas that we can use them in, not just one-to-one therapy, Matt, like you said, but for other applications as well. But then also how to kind of analyze an online mental health platform for whether or not it meets our needs. That's really important. Thanks, Dr. Haley. So Dr. Harris, how do you think online mental health platforms can specifically help with COVID-19?
Right. I think a lot of people are probably cued into this anyway, but one obvious thing is the social distancing that we were talking about, including in the last panel, talking about how, yes, there are some cases where you might circumvent social distancing, but as we all know, in most cases, social distancing physically is sometimes mandatory and sometimes just really a good decision anyway. We all want to do that right now. We need to do that. So this is a way for people who already need mental health resources and already getting mental health resources to continue getting them without having to make decisions like, am I going to go risk getting a virus? So that's one of the obvious and key applications of this. But in addition to that, there might be people that didn't need mental health services that are now going through a stressful time. We all are collectively, as a country, as a world, going through a very stressful time. And people that might have had milder issues are now having these flare up. They might need help more than ever. Between danger of contracting the virus, social isolation issues because of quarantine, uncertainty about the future, upending our normal routines, all these things are very stressful. So mental health resources can be done without physical contact, and they're needed right now. And some of these mental health platforms, that's something that they should address, right? If you have a mental health platform and they're not doing COVID-specific things, or at least anxiety around viruses or anxiety around social isolation, things like that, then they're missing the boat, because that's a key issue that's coming up right now. And that's a way that mental health practitioners in general, but especially online, can really jump in.
And so just to piggyback on that question, what are some specific platforms out there that might help with online practice then?
Right. So without endorsing any specifically, we have a list of some of the more common ones and some of the ones that we've seen that can be helpful, that are going to be in the handout that you guys are all going to get. But I'll mention a couple here, and it kind of hits on my idea of the different variety, that there's ones in different areas. So there's some like 7 Cups that's more chat based. They have these chat rooms. It's free. You can talk to volunteers for free, or they try to get you, of course, to pay some more money, and then you can talk to licensed mental health professionals. You can also talk to the community too for more just community support. So they're really more chat based. There's some that are more talk based. 18% is one that's free online peer support groups. So they're going more of the support group route. I think someone talked about, well, some other ones earlier. There's Talkspace is another really popular one. I also put an article in the handout that has to do with it's verywellmind.com, and they have compiled their favorite 9 different platforms. It's their favorite, so take it with a grain of salt, but they're at least the most popular ones, and they do analyze the pros and cons of each one in that article, which I really do like. So it helps you make your own decision what you're looking for in a platform, not just this is my therapist can see me on Zoom now or Facebook video. I hope not. But what can a platform do for me? And there's different ones for different services. So.
Great. I love those suggestions. We'll definitely be looking into that. And did you say that those are going to be in a resource list?
Yeah. In the handout that people are getting, there's a resource list for each panel, and our panel will have these ones under it.
Wonderful.
Right?
Thanks.
It's been circulating in the chat. Yep.
Okay, good.
We'll continue to add and update to it also. So yeah, as we get more. Yeah.
Oh, thank you. And so thanks, Dr. Haley. So you have an online mental health platform that we've all heard a lot about tonight called TogetherWell. Can you tell us a little bit about the service that you offer and why you developed it? And also, as a second part, what do you think this adds to the field and what's currently out there right now?
Okay, yeah. So I developed TogetherWell conceptually a very long time ago in my clinical work. I've worked with clinical and consulting and trainings. I've worked with police departments, correctional facilities, schools, and just I really noticed that there's still so much mental health stigma. And so when you offer a workshop, it's really helpful because people are willing to receive educational opportunities more so than therapy sometimes. So I find workshops is a really great stepping stone for some people to be able to access information and resources and help them decide how to move forward for themselves. So it's a really nice way to really get in there into the community and give resource and information and just lower barriers to access. And so that's part of why I could probably go to 9 o'clock talking about that PST time. So I'll get off the box on that. But yeah, and so TogetherWell, so and just to underscore too, so TogetherWell is basically an online platform that connects mental health providers to the community in order to provide mental health workshops. And so what that looks like is a principal could come to our site, look for a workshop on a particular topic, and then we would connect a mental health provider to the school. And so that works really nicely because it's a therapist or mental health provider. They don't have to be a therapist. They could be someone with a master's degree or higher with expertise. But they go and they offer this information to people. And then it can serve for therapists as like a referral source, or it can serve as, or people who just want to do it out of the kindness of their heart, but they can also make a revenue. So it's mutually beneficial for both parties. And so we actually—
I'm going to jump in right here. We definitely want to make sure we can get to our last question, but I really appreciate that because I think that as a provider of mental health care, it's often hard to find that community and the people who are trying to get your resources. And so I think it, really is a great platform. I'm super excited about it.
Yeah, and I was just going to say, we started this a long time ago too. So we actually just started. We wanted to cut out the middleman of the connection, and that's why we actually created it to be a platform so that we could really connect people directly too. So yeah.
Yeah, that's great. Thank you so much.
Mm-hmm.
What would you say to someone who's been in the field for a long time and is interested in starting in telehealth?
Mm-hmm. Yeah. So for somebody who's been in the field for a long time and is interested in telehealth, I would definitely say knock on the doors of your colleagues who are currently practicing, because that's where you're going to get your best info. And then sometimes when I've heard colleagues ask who have been in the field for a while, I've heard them say, like, ask me these types of questions. The thing about it that they should really that they struggle with is a lot of their peers are not doing telehealth. And so if they don't have anyone to ask, where do you go? So other options can include like going on Facebook groups and asking questions, or joining an email listserv and posing that question. We're really fortunate here in the Bay Area to have so many great resources that it's really easy to knock on doors. And so if you're in some state that doesn't have a lot of active organizations, knock on a door in a like a neighboring city, or and just try to access information from in that way. And then also you could do a Google search for an online therapist, even if you don't know them, and offer, hey, can I buy you a cup of coffee? I would love to. I hate this expression, but pick your brain and get more information about this. And if, you know, in this COVID situation, it could be a virtual cup of coffee. Like you'd figure, you know, and then ultimately, you know, just conducting research on your own too. Yeah.
That's wonderful. Yeah, I think, you know, it can be really overwhelming because there are a lot of options and choices and things that, you know, that come up when we're looking at the field of telemental health, and it might be overwhelming. Is there any specific advice you might give to someone who's new in the field and just starting out?
Yeah, I would say everything that I just said, plus your school. Like your professors, access your professors, they might know someone. And they're a great resource. A lot of times after we graduate, we think, oh, I'm done with that school, never talk to them again, I'm out. But the truth is we can really knock on their doors. They have alumni services. And if anyone says to you, I don't know, then you just reply, great, can you help me find somebody who does, and continue, and maybe they will. So yeah, that would be my suggestion.
That's a great suggestion, and it made me think as a professor that one of the resources that I often point students to are their professional organizations. So, for example, in California, it's, you know, California Association of Marriage and Family Therapists, or CAMFT, or perhaps the BBS or the Board of Psychology. So maybe your professional organizations too that might have a little bit of information about telemental health and some of the local and regional laws and things that the practitioner might want to keep in mind. So I often recommend that as a resource too. So, and
I'd like to add too, at the bottom of our panel resources, Dr. Harris and I have added additional resources for you to take telehealth courses. And right now, because of COVID-19, they're giving a lot of free courses and discounts out. So if you check out our last section, I think we listed like 4 different great courses that you can access right now. So definitely check those out. And that's for people later in the field and just embarking on their telehealth careers right out of school. So check those out.
Oh, well, thank you both and for your time and effort in all of this. I thank you guys for the audience, for everybody listening. Make sure that you check out the resources in the chat panel, and everyone stay safe. Thank you so much.
Bye, Brittany. Okay, so now this is basically concluding our presentation for you all today. Thank you so much for just joining us tonight and being able to connect and share information and resources. Your comments in the chat have been really insightful. I'll actually get a download of all the comments and questions, so I'll be able to look at those, and that will help us inform future presentations too. I really want to give a heartfelt thank you to the volunteers. As I mentioned in the intro video, TogetherWell is a 100% volunteer organization. And so we relied on several amazing volunteers who made this happen. We couldn't have done it without them. We also want to thank our amazing speakers who we planned this literally in like no time, and our speakers jumped on the opportunity because they wanted to be a part of helping support our mental health community. So our speakers, top notch, thank you so much. I also want to thank again Hopin for graciously offering us this platform so that we could have this tonight and connect with all of you. Senator Bell, who just really appreciates the work that you do and wanted to come express his gratitude for your work, especially during this time of COVID-19. And also for you, for coming and getting more information and resources so that you could help yourself. That is so amazing. And it's late, especially all y'all on the East Coast too. So thank you so much, including Dr. Harris, who's an East Coaster right here. And Joe from earlier in the legal panel. He's an East Coaster. So again, just to reiterate, we have that resource handout. Check that out. We're also going to add information to it over time. There will be a recording of this. We'll post that on the TogetherWell YouTube page. And this platform will be up for the next 10 minutes or so. So please feel free to check out the expo. There's a couple of businesses over there that are willing to answer questions for you if you have any. And then that's pretty much it. Dr. Harris, anything on your part?
You forgot to thank one person, and that's you. One big person is missing. Thanks. As you mentioned, you organized this with no time and did a fantastic job. And there's a reason that we're all so excited to be part of it. Part of it's because it's an important cause. Part of it's because we know you organize a good event and you have a good vision. So everyone give Dr. Haley some props. Give yourself some props, like she said. These are challenging times. This is scary, but don't be overwhelmed by all these resources. You don't have to use every link you see. You're going to get emails from everyone, your organization, from this.
Companies you haven't talked to in 20 years are going to email you. Yep.
There's a million different policies. As long as you're utilizing your best judgment, good clinical care, ethics follows from that if you're doing actual good judgment and good clinical care. And so you don't have to worry that you're doing every single little thing or you're getting yourself in some sort of legal trap. Do your best work. See what resources you can, and it's going to be all right.
Yep. All right. Let's take flight together, everybody. Awesome. Thank you so much.
All right. Thanks, everybody.
Bye.